Today topic was hydronephrosis. This is a very important question for the university examinations, and this is a clinical questions asked in NEET PG examinations related to the hydronephrosis, who we discuss later. And this is a class objective today, who we discuss. Okay. And then first of all, what is the definition of the hydronephrosis? Hydronephrosis simple is the aseptic dilation of the renal pelvis and calyx due to the obstructions to the outflow of urine. But why? Why there are obstructions in the outflow of the urine? We discuss later. And after that, hydronephrosis is associated with progressive atrophy of the kidney, and there is obstructions occur in the any part of the intract. In long term, hydronephrosis leads to the renal parenchymal damage. Okay. And this is a normal renal pelvis and calyx in the human kidney. This is a minor calyx and this is a major calyx. We can see that. And this is a renal pelvis. This is a normal structure of the kidney in a normal persons. But in patients with hydronephrosis, there is what? Aseptic dilation of the renal pelvis and calyx are seen. We can also see that. Then some patients ask me, sir, why I suffer from the hydronephrosis? Why I cannot suffer from the hydronephrosis? Then there is a real questions arise in a patient mind. Then of course there is an etiological factor or an etiology that present in the patient that leads to the hydronephrosis. Let's discuss about the etiological factor of the hydronephrosis. Etiology. It can be unilateral or bilateral. Okay. Unilateral means there is involvement of the single kidney, and bilateral means the involvement of the both kidney. Simple. Unilateral cause may be intramural, mural, and extramural cause, and bilateral cause either congenital or acquired. Congenital means the defect present since the birth. Acquired means acquired in a lifetime. Okay. Then let's focus on the unilateral hydronephrosis. Simple. In unilateral hydronephrosis, first include extramural cause. In this case, there is advanced malignancy like colorectal cancer, cervix carcinoma, and prostate cancer, and other include like retroperitoneal fibrosis and retrocaval. Okay. And in case of intramural cause include pelvic aortic junction obstructions, means at the level of pelvis and ureter their obstruction occur, called intramural cause. And next is ureterocele. Okay, we discuss later. And urothelial tumor and structure formations that are intramural cause of the unilateral hydronephrosis. And next is intraluminal cause of the hydronephrosis, which unilateral hydronephrosis. In this include stone formations, Papill's log, and due to the analgesic nephropathy and sickle cell anemia. Okay. Let's focus on the bilateral hydronephrosis. We know that bilateral either congenital or acquired. In congenital cows, there is posterior urethral valve present and urethral atresia may occur. And acquired cows includes bi bladder neck stenosis, BPH, again prostate cancer and stitcher formations. Okay, and here you can see that due to the congenital pelvic urethral junction obstructions, there occur hydronephrosis in the kidney. Ureterocele, we can see that there is ureterocele present in the patient hydronephrosis, abnormal growth present in the organ. Simple ureterocele. Then further, and this is normal anatomy of the ureter. We can see that, and we can see that this is real pelvis and this ureter, and at the junction of the pelvis ureter there is obstruction occur that leads to the hydronephrosis. Simple. This normal anatomy ureter, we can see that pelvis and ureter junctions. Simple, there is nothing here. Here you can see that bilateral congenital hydronephrosis in patient with the child with the posterior urethral valve. There is urethra and there is no valve in normal individual, but in case of congenital defect, there is posterior urethral valve that block the flow of urine and leads to the hydronephrosis. In a figure presentations, we can see that normal. Okay. This is the intraliminal cause of the hydronephrosis. We can discuss early. Here we can see a stone in the ureter and slope papillary in the papillary necrosis. We can see the slope papillary necrosis that leads to the hydronephrosis further. Okay. This is the acquired cause of the hydronephrosis. How? Benign posted hyperplasia. This is normal. Okay, and there is benign prostate hyperplasia that leads to the obstruct urine flow, that leads to obstructing urine flow, and it which patient develop hydronephrosis, and this is acquired cause of the bilateral hydronephrosis in a patient with benign prostate hyperplasia. Simple. This is very important. Okay. Then further, this is image of the bilateral hydronephrosis, which may be acquired or either congenital. And in case the bilateral hydronephrosis, we can see the structure of the kidney, extra kidney, and structure of the inner bladder. This is very severe in the unusual. There are 4 degrees of the hydronephrosis. First is normal, of course normal, there is no any effect. Mild, slight, moderate, and severe, very severe. There is abnormal dilation of the renal pelvic and calyx called hydronephrosis. Then what is the pathophysiology of the hydronephrosis? It is very important. Also I have seen the examinations. Due to different etiological conditions, we discussed that either hydronephrosis is unilateral and either hydronephrosis bilateral. You know that. And due to different etiological conditions, what happens? There is obstruction in the urine flow, and that leads to the increased hydrostatic pressure in the collecting system of the kidney, and that further leads to the increased intraglomerular pressure and decreased GFR. And here there leads to 2 conditions. First condition is either it undergoes the acute conditions, either it undergoes chronic conditions. Okay, in acute condition, if there is removal of the obstructions, then patient can recover. Okay, but in case of chronic hydronephrosis, there is prolonged blockage leads to the losses of the renal functions. Of course, if there is prolonged blockage in the part of the urinary tract, that leads to the loss of renal functions. And what happened? There is carrying and irreversible kidney injury occur that leads to the further decrease glomerular and tubular functions. Okay, of course, the decrease in glomerular and tubular functions that result in abnormal dilation of the collecting system that cause papilloma compressions and parenchyma thinning. That further leads to the cortical atrophy and tubulointerstitial fibrosis. Okay, the next things is that due to decrease glomerular and tubular functions, it can defect in the sodium reabsorptions and disturbance of the urine acidifications, and further that leads to the metabolic acidosis, okay, in a patient with hydronephrosis. And this is a pathophysiology. Hydronephrosis matlab means what happen in patient with hydronephrosis, how it leads to the different complications in patient with hydronephrosis. This is pathophysiology, normal pathophysiology in patient hydronephrosis. Okay, and in patient with hydronephrosis, there are two features are seen. Simply early features and chronic features. In early feature, there is dilation of the pelvis and calyx, mild, and there is interstitial inflammations. But in case of chronic cases, cortical tubular atrophy can be occur, and marked diffuse interstitial fibrosis can be seen. Okay, but there are two important features that are seen in patient hydronephrosis, morphological features. First is marked dilation of renal pelvis and calyx and renal cortical atrophy. Simple. We can also see in the figure that there is calyx and renal pelvis, and in patient hydronephrosis, they mark dilation of renal pelvis and calyx. Simple. Then what sign and symptom present in a patient with hydronephrosis? Okay, a patient having hydronephrosis, what sign and symptom present a patient that that is diagnosis. We can confirm diagnosis from the clinical features. So clinical feature of hydronephrosis depends upon the degree of obstructions and underlying cause. Then first feature is that flank pain. Flank pain may be dull acting tap or colky tap. And hematuria means there is blood in the urine, of course. And third is decreased urine output. Of course, there is obstruction in the urine flow that leads to the decreased urine output. And of course, there is problem in the kidney. So patient having hypertension and long term leads to the renal failure, and patient also experience the symptom like dysuria, and in some cases fever and chill also present in a patient with hydronephrosis. This is clinical feature that present in the patient hydronephrosis. Okay, suppose a patient with hydronephrosis bring to your hospital or clinic, then what are the investigations can be done in patient hydronephrosis? First is simple blood urea and serum creatinine estimations, and next is urine for microscopy. Okay, can do in first two tests. What are they? Blood urea and serum creatinine level estimations and urine for microscopy. And next is ultrasound of the abdomen is the investigation of choice in patient with hydronephrosis. Here you can see that what are the types of pelvics, okay, and thickness of the parenchyma and site of obstructions and cause of obstructions, okay. And next is that intravenous urography. Here dye is injected into the body by IV route, then X-ray light is passed through the body to visualize the part of the renal system. Okay, in normal persons, normal calyx is curve shaped, but in patient hydronephrosis, calyx become broad shaped. Okay, and next is CT scan. CT scan is the diagnostic test in patient hydronephrosis. And next is isotope renography. And next is Whittaker test. In this test, a fine needle is passed into the renal pelvis through loan of a body. After that, pelvis is perfused with saline at the rate of the 10 ml per minute. In normal individuals, what happen, normal individuals initially pressure rise and later become constant, but in patient with hydronephrosis, there is persistent increase in pressure suggests hydronephrosis. This is called we take a test, which is the investigation for the hydronephrosis. Simple. And patient with hydronephrosis show the following complications like renal failure, chronic pyelonephritis, pyelonephrosis, and high chance of renal stone formation means renal calculi. Thank you.